that the drive doctor, Dr. Osafo, would throw some light on one of the issues that Mamiya in East Legon shares with us. So Mamiya says, Lexus, how true is it that when boys and men lift heavy things consistently, they can get hernia? I'm 24 years. I live with my parents and an 18-year-old brother. So my brother is working hard at building muscles. I don't know whether it's at X gym, but he's a workout freak. And when you see his pictures, he really does lift some very heavy metals. My mother keeps telling him to stop, else he will develop hernia. My brother and I will always laugh it off, and often we'll ask her to explain it, but she's unable to. So the consistency with which she says it whenever my brother is going to the gym made me decide to look it up on the internet, and indeed I discovered that excessive weight lifting could make one develop a hernia. But what I did not actually get was the fact that it is one's intestines collecting in the scrotum. I do not understand that. And it just makes everything even more confusing for me. So could the drive doctor take time off to help explain this to us? And that's the issue we're talking about. Thank you very much, Mamiya in East Legon, for bringing this topic up. Dr. Osafo, I'm particularly concerned about this, and I'm sure you would understand why.
Starts with an X.
Yes, I mean, because I'm also in the gym all the time.
Exactly.
Well, lately I don't take heavy weights. I'm doing a more cardio routine, so I'm not about weights now. But I see the brothers, going in on heavy weights, deadlifts, and whatnot. So Mamiya's conversation is well, good time, I should say.
Absolutely. Right, good afternoon to all our listeners, and it's great to be here another Wednesday. Today we're going to discuss hernia, and contrary to what most people think, that it's a male problem, it can be a female problem as well.
Is it?
Yes.
Wow.
So Alexis, what's a hernia? Well, a hernia is a protrusion of an internal organ or part of it from the cavity that contains it. So something is pushing out. What we mean by a protrusion means something is pushing out.
Mm-hmm.
And that something usually is contained within a cavity, a space. And it is coming out of that space to the outside. So what most people refer to as their stomach, Ghanaian English, stomach. Actually, we refer to it as the abdomen. Yes, your stomach is a little sac inside of that cavity we call the abdomen. So that whole thing, that part of your body that extends from the lower part of your ribs all the way up to the just above the pubic bone, we'll refer to that part of your body as your abdomen. And it's a big space. When we open it up with a knife, it's a big space. And when you open it up, the first thing you would see are intestines. So we can look at the intestines as organs. So a hernia simply means that these intestines, let's restrict ourselves to intestines, are pushing out of the abdominal cavity and coming out. So most people will see a mass or a swelling in a region of the abdomen or in the groin. The groin is the commonest area that most people would see. And the mass sometimes may extend into the scrotum, as we got from the message.
The small scrotum.
Yes. So imagine the intestines. And if you've killed a goat before, you've opened it up. The intestines are quite, it's a lot. It's a lengthy thing that is coiled on itself. So imagine all of this thing pushing into your scrotum.
Wow.
Case 5. Sometimes I see some of it, and what's hanging in between the man's legs, you wonder how they've kept it for that length of time. But it can get really big because it stretches. So how does this come about? How does one get their intestines coming out into the scrotum or protruding into the groin? Well, there are two main factors that causes a hernia to develop. The first is that there is a weakness most of the time in the wall of your abdomen.
Okay.
So you see, when we go to the gym, we all want a six-pack. This morning, somebody came to Medina clinic and said, doctor, me one pack here, I want a 6-pack. The 1 pack is the pot belly. They want a 6-pack. So that's
I know where they sell it.
Yeah. So that firmness we find in the anterior part is what we call the anterior abdominal wall. So when there's a weakness, then the contents, the intestines, can then move or protrude out of that weakness and then come out. It's just like you have a fence wall around your home, and then a portion of it is weak. Well, you can have all sorts of organisms going in and out of your compound. So it's pretty much the same thing that happens when generally there is a weakness in the anterior wall of the abdomen. Then things can push out. How does this weakness happen? The weakness may happen during formation when you are a baby inside your mother's womb. So sometimes you are born with it. The structures that are supposed to form, that gives the wall the strength, doesn't form, and therefore it's a natural weakness, if you like. Again, the weakness may be due to aging. So sometimes we may see hernia in elderly individuals. Look at our skin. When you are young, your skin is nice, taut, smooth, firm. As you grow, what happens to your skin? You begin to wrinkle. It sags. So the skin under your chin, under your eyes, they all sag. So pretty much the same thing happens with the wall of your abdomen, that you get some kind of weakness happening with aging, which is something that you cannot help. Multiple pregnancies. Anytime a woman gets pregnant, the walls of the abdomen get stretched, very stretched. Then after the pregnancy, it goes back. And that's why we encourage a lot of women to, hit the gym or start exercising again after they have their babies. Most people disregard that particular advice, but it's just supposed to firm up your anterior abdominal wall, your stomach. Let me stop saying the abdominal wall, because most people, and let me use the Ghanaian parlance, stomach. It's supposed to strengthen your stomach muscles, right? So multiple pregnancies. So if you have 2 children, 3, 4, or 5 children, the more children you have, the weaker your stomach wall muscles become. Sometimes too, when we perform surgery on individuals, the cuts that we make on the abdomen sometimes can get infected, and then the scar that is left behind is not as strong as it should be. So these are the various ways by which the weakness happens. The other main mechanism is increased pressure in the stomach or in the abdomen.
In the abs.
Yes, increased pressure. Chronic constipation. So sometimes when people are really constipated, let's say the loo is here, you're at circle, you hear them. And you build up, you increase the pressure in your abdomen so much because you're trying to push the feces out. And as you do that, you push the intestines to against the natural areas of weakness that exist in your abdomen, in your abdominal wall. So if you experience constipation over a long period, what we call chronic constipation, then you're at risk of developing a hernia. Again, men who develop enlarged prostate glands. So you see, when you develop an enlargement of the prostate, it obstructs the pathway for urine flow outside. So people actually strain when they have to urinate. They strain to the point where sometimes they have to pass wind. So those with prostate enlargement also have a tendency to developing a hernia if it goes on for a long time.
What is pass wind?
Oh, Lexis, let's continue.
The girl sitting there wants to know.
Heavy manual work. So again, the laborers, those who do heavy manual work, it also increases the abdominal pressure in the abdomen. So those who are into the Wala to Walasa business, you would know the Kaya, they do a lot of heavy lifting. All these things tend to increase the pressure in your abdomen. Then, of course, those who go to the gym, they want the muscle, they want the bulk, so they need to do a lot more work. Before we came on air, I was telling Philip that some people also lift heavy weights somewhere else. Alexis.
Doctor, you blast.
So that one I will talk about it. But
Okay. Alright.
weightlifting. So let's just leave it at that.
Okay.
Weightlifting. So if you lift, you shouldn't lift something that you can't lift. Like this. Nobody should lift things that they cannot lift. So the weight that you attempt to lift must be appropriate. So again, that would also build or increase your abdominal pressure.
Okay.
And then I also mentioned the frequent pregnancies. So the young men who go to the gym all the time, there is a natural area of weakness. You know, the nuts or the testes, before they come into the scrotum, they start from the abdomen, inside your stomach, if you like, and then they move gently through a pathway in your groin. The groin is that area between your lower abdomen and then your thigh. So that curved place.
Yeah.
And it moves through that path into the scrotum. And that pathway is there. So it's a natural area of weakness. And that is why when you go to the gym, we would encourage you to use belts.
The belt.
Those big belts.
Yes.
And you wrap it around your waist or the lower abdomen. That's where you actually apply it. Because of the existence of that natural area of weakness. Women also have it. Although women don't have a testis, there's something we call the round ligament that moves in that area into the vulva.
Okay.
So there's that natural area weakness in that particular area, the groin. So that is the most susceptible place where we see a hernia. So women can also suffer a hernia if they have all these risk factors that I have discussed earlier. So if they also lift weights without using a belt, they can develop a hernia. If they develop chronic constipation, they can also develop a hernia. If they are involved in heavy manual work, they can develop a hernia. If they are lifting weights, they can also develop a hernia.
Okay, so a lot of people are going to be lifting stuff naturally. The first caution we've been told is the belt.
Yes, the belt.
Now, what other things can we do to prevent a hernia?
Right. So, if, for example, you have chronic constipation, then we will have to solve that problem of chronic constipation. I think the other time we discussed it on this show. Sometimes you can have what we call a functional constipation, or sometimes it might be an obstruction. So if anybody listening to us right now has constipation, chronic constipation, you need to see your doctor and then let the doctor evaluate the cause of that chronic constipation, and we got to get it relieved. So that's number one. Some individuals may also have a chronic cough, and typically tuberculosis can do that. Or you may be working in an environment where you have an allergy. So a chronic cough, anytime you cough, some people can cough very violently, and that can also increase the pressure in the abdomen. So one will also tackle that.
Okay.
But most importantly, you need to have the proper lifting technique. And you also need to not to lift weights that are too heavy for you. So sometimes people have a lot of aggression when they go to the gym. They want their six-pack and they want it quick. They want it in, 2 weeks or so. Not knowing that it takes years. So they want all of a sudden to go for the heaviest weight or metals available. But you need to go gradually until you build the requisite bulk, then you add on. So these are the essential, things that you need to do to avoid the developing a hernia.
Okay. Well, let me just tell folks to send in their questions as well. 0244340437. You have any question about our topic today, you can send it in right away. If you're on Twitter, the hashtag is DriveOnJoy. So, what's the remedy if the intestines get in there? How do you get it out?
Right, but before we go there, let me just briefly mention the various types, because most people just think about the hernia in the groin, which we call an inguinal hernia. That's a hernia in the groin. That is the commonest globally. But a hernia that protrusion can also occur in other parts of the abdomen. There's one that occurs around the belly button. So I'm sure you've seen it. People sometimes with a very prominent, very big belly buttons. Yes, okay. It comes out and sometimes it goes back by itself. They will tell you that when they lie down, they lie on their backs, then it sort of like disappears.
Yeah.
When they stand, when they cough, when they laugh loudly, then it comes out. So we'll call that an umbilical hernia. That's a hernia, a defect. There's a defect in the region of the belly button. And therefore, the intestines can just move into it and give it that prominence. There's also a hernia that can happen on the upper thigh, the upper part of the thigh. So we call that a femoral hernia. There's also a hernia that can occur to the side of the belly button. And then there's also another one that occurs in the upper central part of the abdomen. So these kind of mass or swellings can occur in different parts. But the key to identifying them is that sometimes when you put your hand on it, you can actually press with your fingers and, as we'd say, reduce it. So it comes and goes. So anytime you have a mass anywhere on your abdomen that comes and goes, most likely it is a hernia. Right. Now, we've heard a lot of funny things about hernia. People will tell you that, you can melt it. We have medicines. Thankfully, this week I saw something from the FDA saying that they're going to ban the advertisement of certain, disease conditions. And hernia was on that list.
Okay.
And I'm very happy about that. Because I see a lot of adverts saying you can melt it. Hello, who wants to melt their intestines? So there's no medicine to melt it. Anybody tells you that they've got a medicine that will melt that particular hernia, no, you are not going to melt your intestines. So the mainstay of treatment for hernia is surgery. It's a surgical repair. I keep telling people that, when we're kids, you go and play around and then your shorts, you get a tear the back of your shorts. What do? Your mother won't go and sew a new shorts for you. She'll stitch it. She'll stitch it. So a hernia, there is a defect. There is a hole there through which something is going through, is protruding. So what we need to do is to stitch up that defect. It's a very simple procedure, depending on where it is. It can be very, very simple. And it is the commonest surgical procedure that is performed globally. Hernia repair. So it's quite common. So it's surgery. It's surgery. It's surgery. There's no answer to it. There are different surgical techniques. Some are very, very simple and straightforward.
There's no medicine that will get it back out of the hole.
No, because if you think about it, there is a defect. There is a hole that exists. So until we seal the hole, the intestines can keep going in and out. Go ahead.
Everybody has this hole.
Well, when it comes to the groin, that potential hole is there. It's a potential space. It's there. So if you go and do the heavy lifting over a prolonged period, then you would force that hole to become prominent, or you force the intestines to come out through it.
But if you're going to stitch it afterwards, isn't that not going to give you any problems?
No. So we are closing up that defect, that potential defect. That defect existed because your testes had to go through it and come into your scrotum. So now that has been done. I mean, your testis is not going to go back the opposite way ever. It's going to stay there. So that defect needs to be sealed. If it's around the belly button, we need to just close it up, once and for all. So we don't have any issues. So once we stitch it up, it's like your shorts is torn. We patch it up. So I just want people to imagine anybody with a torn, shorts. What you do is you take it to your mom, and your mother will stitch it up. That is how we treat most, hernias. If you don't treat it, you can get complications. It keeps going in and out, but it can get stuck. Yes. When it gets stuck, then there's trouble. It can cause excruciating pain, and then you can get something we call intestinal obstruction. It's your intestines that are in there. So if you force it through that small hole, it can twist on itself, and then the insides of it gets blocked. So food and feces can't go through that obstruction. And that is a surgical emergency, and you need a big operation to try and repair that.
0302216541. Let me activate the phone lines. You can call in if you have any questions for Doctor about our topic today, okay? So 0302216541. You can call in now, or you can send in a WhatsApp message on 0244340437. Lexus, I have mild pains in my testicles. There's no lump in my testicles. Is it a symptom of hernia? It's from Kofi Nungwa.
Well, Kofi, most likely not. So for a hernia, most often you would see a swelling or a mass. And as I said, most of the time the mass initially is reducible, meaning it goes back. Especially when you lie down or when you put gentle pressure on it, it goes back. So if there's no swelling, there's no mass, most likely it is not. But if there's pain in your testicles, then you need to get it examined.
Okay, Oti Boateng is here. Hello, Oti.
Doctor, afternoon.
Hello, good afternoon, Oti.
Yeah, my question is, sometimes your testicles is not big.
Yeah.
But when hernia became in, it became big. Why?
Yes.
And my second question is, should any man have hernia? Or is there steps it will come? If it not come, expect that it will come or it will not come.
Okay. Right. So, Oti, let me take the second question first. You know, the potential for every man to develop or female to develop a hernia exists, especially the inguinal type, the one in the groin.
Right.
So if you go on and you do heavy lifting or you develop chronic constipation, then that particular type of hernia, potentially you can develop it. That's why we talk about using the belt the right way and lifting weights that are appropriate, you know, for your strength.
Okay.
So potentially, yes, everybody can, but the risk factors must apply. Number two, you was asking about the size. Yes, a hernia, you are pushing all your bowel or largely bowel and then some fat tissue into the scrotum. So, of course, it's going to get big because you've got your intestines occupy quite a significant volume. Okay. Not all of it will go in there, but part of it can go in there.
And that's also going to affect digestion, right?
Exactly. You know, so if it's all in there and trapped in that little space, then it can get, you know, it can turn on itself, get contorted, and then the lumen, food can't go through properly. So, yes.
So it can cause death?
It can, because it can rupture. You know, it can perforate, it can rupture, and that's a surgical emergency. When your intestines rupture and you pour out all the intestinal juices and then the feces into your abdomen, that is a surgical emergency.
Kafui. Is Kafui on the line? Hello?
Hello.
Hi, Kafui.
Yes, please. I wanted to find out more about the chronic constipation.
Right.
Yes, I want to know more because my sister has been having. She can stay a whole week without going to the
yeah, we know.
the White House.
We know.
Yes, so I want to know more about the chronic constipation.
Right. Well, I would encourage you to go to our Facebook page, Medical's Hospital, because a few weeks back we had a full discussion on constipation. Okay. There could be different causes, but most commonly the functional ones occur in younger people, and it's mainly dietary. Okay. So you can call me after the show, and then we'll have a full conversation, you know, about that.
Lex, learning about the formation of this hernia is quite scary, but please ask Drive Doctor whether the protrusion is accompanied with any pain. What is the probability of its recurrence after surgery? From Efia Kobi in Soto.
Actually, it's the pain that brings most people to hospital. The pain is what brings most people to hospital. As I'm saying, it can get strangulated. See, sometimes the hole is very small. If the hole is big, the defect is big, then most of the time you don't get any complications. If the obstruction, the hole is very small, and you force the intestines through it, then it gets trapped, incarcerated, and it causes a lot of pain. So that is what gets a lot of people to hospital. So yes, it can cause pain. She asks about whether recurrence. Unfortunately, everything we do, sometimes we are not 100% successful. So some of the techniques or methods we use for the repair can lead to a recurrence. But also, it depends. The person goes back to doing the same things. If those same risk factors apply, you go back to doing the heavy lifting again, then sometimes it breaks down. Okay. But largely, we are successful.
Adam in Tema wants to know how one can prevent hernia.
Right. So again, we'll go over it. I mean, whatever you are doing, if you have to do manual work, then you have to make sure you lift weights that are appropriate for your strength, and then use the right technique in lifting things from the floor. And please use a belt.
Very important.
Use it the right way.
Kissy?
Yeah,
let's hear you, bro.
Yeah, I want to know whether hernia occurs in male children.
Thank
you very much. So, whether they occur in male children.
Okay.
Oh, okay. All right. Yes. So it can occur. Remember, I mentioned that sometimes the defect that we have in the wall, the hole that we have in the wall, it occurs because during formation of the baby, things didn't happen right. So you can have a hernia very early on in young children, and we repair it. I mean, we've seen it. We do it in 3-year-olds and 4-year-olds and 6-year-olds.
Okay.
You know, so it can occur in female children as well.
Emmanuel says, I feel pain and pressure in my groin and no visible swelling in the scrotum or in the groin. This happens periodically and the doctor says I might have to live with it. What should I do?
Right. So there are two things that we always say when it comes to examination for a hernia. We'll talk about a visible and then also a palpable impulse, meaning palpable means you can feel it. So sometimes we will put our hands right over the area where the person feels the pain and we ask them to cough. And sometimes when they cough, you feel something, against, your fingers. So we may need to do both to be able to find out, because sometimes when it's coming out, the defect is so small, you don't get everything protruding to become so visible, but you need to examine it, and it depends on how delicate and sensitive your fingers are.
Last message before we wrap up. Lexus, my friend has only one ball. What happened to the other one?
These days, people are saying this, so we'll need to examine it. There's something we call undescended testis.
Okay.
It's a very serious condition. Both are supposed to descend into the scope. So if it doesn't descend, we have to find it.
Okay. Well, please, the team at Medicas are capable of finding it.
Yes.
Yeah, they've got all the right tools and personnel to do a search and
For the
rescue.
yes.
Search and rescue for the missing testes. Doctor, thank you very, very much. Always good to have you. Let's have your contact. I'm sure people would want to further this conversation with you and the team. And good news is that the Medicas Hospital has opened a new branch in Medina.
Yeah, last Thursday was a great event. Thanks
Good
for coming.
stuff.
People were thrilled to see you. Yeah, so we'll continue the conversation on our Facebook page, Medicas Hospital, and our telephone number is 0501 477 340.
Dr. Yao Osafo is CEO of Medicas Hospital. Komla is here with the latest updates in news. Hi, Mr. Testis. Sir.
Like this. Come here.